Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, September 23rd, and this is my COVID weekly briefing. First, I just want to let everyone know that as we're seeing increases in cases, we are going to start increasing our briefing, so you can stay tuned for that. As of today, we've had 656 cumulative positive cases of COVID in Missoula County to date. That's up 122 new cases in the last week and 17 new cases since yesterday. We've had 491 recoveries and 3 deaths. 2 Missoula County residents and 3 non-county residents are currently hospitalized in Missoula County. We now have 162 active COVID-19 cases, which is up from 91 active cases 1 week ago. We've currently identified over 720 close contacts. Those active cases and their close contacts will remain in isolation and quarantine, and they're being supported as needed. The state of Montana is reporting 10,912 cumulative cases, which is up 214 new cases from yesterday. There are now 2,237 active cases with 124 active hospitalizations across the state. There have been 165 deaths related to COVID-19 statewide. We are now posting the Associated daily data daily to our website. In the past week, we've had 34 new cases associated with the University of Montana, and there are currently 48 active cases associated with the As indicated by our case numbers, we're seeing a very rapid increase in COVID-19 activity in Missoula County. Our active COVID case rate per 100,000 people is currently at 101, which is nearly double from the 58 that we were reporting last week. The state of Montana as a whole is seeing 244 active cases per 100,000 people, which is up from 198 last week. Our reproductive value in Missoula County is still holding just below 1, but we're anticipating with the rise in cases that we will likely be over 1 by the end of this week, and will likely be the highest that we've seen so far in this pandemic. We are continuing to see the largest source of exposure as close contacts to a confirmed case. So that brings me to our next topic. I would like to revisit some of the basics, as I've been getting quite a few comments and questions in the past week about some definitions. So let's start with some basic definitions related to infectious diseases. An epidemic is defined by the CDC as an increase, often sudden, in the number of cases of a disease above what's normally expected in that area. An outbreak carries the same definition of an epidemic, but it's often used for a more limited geographical area. A cluster refers to a group of cases in a place and time, and a pandemic refers to an epidemic that has now spread over several countries or continents, affecting a large number of people. When we're contact tracing, we speak with the person who tested positive, and we do an in-depth interview to determine who they've been within 6 feet of for a cumulative 15 minutes or more. That means that if you were within 6 feet of someone for 5 minutes at a time on 3 separate occasions while someone is contagious, then you would be considered a close contact. When you're identified as a close contact, the health department staff will contact you to let you know that you need to enter into quarantine. Quarantine means that you need to stay at home and not interact with anyone else. You will need to be quarantined for the full 14 days from the last known exposure. We at the health department then facilitate testing as long as it's been at least 3 days since your last exposure. The reason that we do that testing is for early identification of new cases. Even if you test negative at that point, you still need to remain in quarantine for the full 14 days, because a negative test just means that you are negative in that moment on that day. It doesn't predict whether you're going to develop symptoms later in the incubation period, because remember, you can develop symptoms anywhere from 2 days after your last exposure to 14 days after your last exposure. So let's say you were not following the quarantine order and then you go on to develop symptoms, you will have exposed everyone that you had contact with for 2 days before you developed symptoms. That's why it's really important to follow that quarantine order. For those who test positive for COVID-19, you should remain isolated at home and away from others until you're released from isolation by a staff member from the health department. We follow the CDC guidance for determining at what point you're no longer contagious and you can return to your normal activities. I've gotten a lot of questions from schools and employers asking how they know that it's okay for someone to return to school or work after quarantine or isolation. At the end of your quarantine or isolation, you'll be offered a letter that gives you the date that you are released, and you can then provide that to your school or your place of employment so that they know it's safe for you to return. I also just wanted to let you know that DPHHS, under the direction of the governor, is publishing to their website each week on Wednesdays a list of schools, including elementary, middle, high school, colleges, and universities, and their number of cases. So if you go to dphhs.mt.gov and then go to their COVID demographic page, you can find a link to that report. Lastly, I just want to remind everyone that we are seeing a significant spread of COVID-19 at this time. It's really important to continue keeping your social circles small, practicing social distancing whenever possible, and washing your hands frequently and wearing that mask. Remember that this is not a case of stranger danger. We're spreading it to each other at this point. We're giving it to our family, our friends, and our coworkers. So it's really important to continue practicing prevention when you're around anyone who's outside of your immediate household. So that's it for my weekly briefing. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can call 258-INFO if you would like to schedule a test through our drive-through testing facility. Out on Flynn Lane. You can also call that number if you just have other general questions about COVID-19 that you would like to get answered, or you need to know what resources might be available to you in the community. And you can check out our website at missoula.co/cvirus for the most current and up-to-date numbers and information. So until next time, everybody, stay healthy.